The ACL is the main ligament in the knee that supports the stability of the knee in the pivoting and cutting sport athlete. ACL tears are a very significant problem in pivoting and cutting sports and leads to quite a bit of problem for pivoting and cutting sport athletes. This video will briefly discuss how ACL tears occur and the best ways to diagnose ACL tears. Hopefully this will give you a nice overview of ACL tears, how they happen, and how we make the diagnosis.
So we're going to look at the bony anatomy first of the ACL. The femur is the thigh bone. You can see the arrow pointing to it. The tibia is the main bone in the lower leg. And the fibula is the smaller bone in the lower leg. Now the ligaments about the knee, there's four main ligaments. The ACL in the central portion of the knee. The PCL resides behind the ACL, and that's why they're called the crossing ligaments. They cross each other, or cruciate ligaments. The MCL is on the medial part of the knee, and the LCL, or lateral collateral ligament, is on the outside or lateral part of the knee. So let's look at what a normal ACL looks like. This is at the time of an arthroscopy, and the probe is pointing towards that ACL as the knee is bending and straightening. That's the normal ACL running from the femur to the tibia. So what are the functions of the ACL? Well, first, it's to control the anterior to posterior translation of the tibia, which means the front to back motion of the tibia or lower leg. Prevents the lower leg from coming forward. And then, maybe more importantly, it controls rotation of the tibia with turning and twisting type motions, which are really so common in sports. So the ACL is critical for knee stability in athletes. It's necessary for the pivoting and cutting rotational motions. So how do ACL tears occur? Well, they can be contact injuries like this direct blow to the lateral or outside part of the knee, or this blow to the front part of the knee. But more commonly, they're non-contact injuries. And non-contact injuries can be hyperextension injuries to the knee, hyperflexion, jumping, landing from a jump, pivoting, rotating, numerous mechanisms. Can be somewhat innocuous, such as just putting the foot down and turning and running, or more severe, like this very popular one that occurred. So how do we diagnose these ACL tears? Well, first, a history of a characteristic injury is helpful, and then very often the person or athlete will complain of a very loud pop that occurred. It's very painful, there's abundant swelling, and they usually need crutches. So the knee may look like this one, where the right knee in this person is much larger than the left knee. But then as the initial symptoms subside and the knee starts to feel better, mobility improves, but then instability issues develop. The knee starts to buckle and give out, and it's hard for the athlete to return to sports. Now our best physical exam test is called the Lockman test, and we stabilize the tibia and the femur, and the lower leg or tibia is translated anterior or forward. Here's a slow motion of that. You can see how the lower leg in my right hand is translating in an anterior or forward direction. That's an ACL tear. X-rays should be obtained when an ACL tear is suspected. They're usually normal, but they're important, and they're important to rule out a fracture. These X-rays are normal, but the arrows point to the growth plates that are open in this teenage athlete. Now, the best non-invasive diagnostic test to determine that someone has an ACL tear is an MRI. And this is a side view or sagittal view. F is the femur, T is the tibia, and the double arrow right there is the ACL. It's that thick black structure that should run from the tibia to the femur and be a nice thick straight line. Now, if you contrast that with this MRI, what you can see here is you can see the two purple arrows are pointing to the tibial and femoral origins of the ACL, but the pink arrow is pointing to the disruption between those two ends, and that's a complete ACL tear. So the next step when an ACL tear is diagnosed in an athlete is to fix it. And this is removal of the torn portion of the ACL, and then you'll see that it's been replaced with a graft. The details are purposefully left out so that they will be the subject of a future video.